had a spirit that Mommy Christy King took us. I'm wondering whether I should still give my talk. But it's quite an important topic for ladies and for women. We need to know. They say knowledge is what? And every time, every day, every time, every week, every year, every month, we get to see this condition in the place I work, and then every day, this particular thing is peculiar to this my gender. Say my gender. You know. And then women are dying every day. Every day women are dying. Women are dying. And it touches my heart. And I want to, everywhere I go, I had opportunity some years ago to be at the IDP camps. And in fact, I was telling her when we were to do this topic, I said, if we have opportunity, we will just move to the rural areas where we don't even get statistics of these things. That's where the thing is. That's where the cocoa is. When I was in the village and I saw what cervical cancer is doing to women, it was like every woman we tested was positive. And that's how they die and continue to die. Please, my people, permit me, I'm going to be talking on prevention and early detection of cervical cancer. Who is going to be with me? Because we'll be moving very fast. I don't have time. Okay, the next slide. Look at that particular place I have circled. That is the uterus. Before I go further, let me maybe say one or two things about the qualifications I have. I'm a certified reproductive nurse. I'm also a trained theater nurse. I am a midwife. I am a nurse practitioner. I am a trauma nurse. I have a lot of certificates. So we just relate that one to what. And then I am a transformation agent. That's, I don't take for granted. That's who I am. Going around saving lives for people and helping my gender to understand the purpose that we have here on earth. Now, that diagram is the uterus. The uterus that carries the children. That's the two things you see there is the ovaries and then the fallopian tube, if you remember your biology. And then the place I circled is the place we're going to be talking of. And it's a place, that small, tiny organ that is taking a woman's life almost every day. Every day, every day. Because I've sung so much, my throat is dry. Can I get water? Now, the next slide. I won't be saying it, so I'll be moving the way you want me to move. Now, cervical cancer is that type of cancer that starts in the cervix. And then I will describe cervix today. Every woman, especially for some of us that wash and dip our hands under our private part, sorry for the men, is our thing. We know ourselves. And it will help you if you have a wife or a sister or a mother. You will go back and tell them. When you dip your hands inside your private part to wash, that thing you touch that looks like this tip of this nose, that's the cervix. It's part of the uterus and it's right there in the vagina. So as you squat to wash or whatever position you use, you usually feel that thing. And that's what we're talking about. So it shouldn't be strange to us. If you are a woman and then a woman, when you go for labor, they say the cervix has not dilated, right? During labor, it has not dilated, so the baby cannot come. It's that thing that moves and then open up that the baby comes out. It's the bridge between the uterus and the vagina, you know. So it protrudes into the vagina. Now, it is that lower part of the uterus that connects to the vagina, like I said. This cervical cancer is caused by the human papilloma virus. You know, I will talk about the human papilloma virus. The next one, please. Later. Now, let's look at the incidence. They said cervical cancer is one of the most common cancer. That's against what? Breast is the first. Breast cancer is still affecting my gender. Then the second most common cancer is the cervical cancer, still affecting this my gender. And then we said In 2020, there was an estimated case of 604, right? 1,000 new cases of cervical cancer globally. You can imagine, 604. We keep having cancer daily. It's diagnosed daily, and we cancer globally. Now let's go to Nigeria and see what's happening here. Let's come back home. I didn't dwell much on the global figure, so let's look at what's happening in Nigeria. It is the leading cause, like I said, and especially it affects the low-class people to the middle-class people. Reason being that the low-class don't even have knowledge about this, right? They don't even care to know. And if they start having symptoms, they don't even go to the hospital. They just look for area around them and start doing all manner of things. In case I forget, please draw my attention back to Kaya Mata. Then I will tell you people what Kaya Mata is doing for us. Do you hear me? Once I want to go, tell me Kaya Mata, then I will gist us. Now, Nigeria has a population of 60.9 million women ages from 15 years and older who are at risk of developing cervical cancer. Now, cervical cancer doesn't happen to a woman as from 75 years and 80 and thereabout. She doesn't have it because by then all her organs have gone down. But those reproductive age of 15 till 65 years, we are still at risk of having cervical cancer. Do you understand? So who is more than 75 years old? So all of us in the room have tendency to have cervical cancer, isn't it? When we say these things, people say, God forbid. And then you see people come, big women, rich, old, young, coming down with this same. Some of my colleagues are here. There is no week. I said no week, no day in the week that we don't get to take samples, specimen for already grown cancer in this Makurdi. I'm talking with facts. So it's something that I have seen every day. Yesterday I saw one, and it's cervical cancer. Now, on the average, let me take that estimate, sorry. On the average, 28 Nigeria die from cervical cancer every day. 28 people daily. Do you understand what I say now? When I say it's a serious issue. That was in 2018. So 2018 to now, you can imagine what it takes. Nigerian dying, and resulting in a total of like 10,000 deaths. It is the second most cancer in among women in Nigeria. Now, the next slide, please. Now, the current estimate indicates that every year, about 12,075 women are diagnosed of cancer, and about these people, this thing is daily, and after that, 7 in a year. Imagine you diagnose 12,000 people, and then that same year, about 7,900. Let's round it off to 8,000 out of 12,000 people that are diagnosed die. Is that a good prognosis? No, it's not, because out of 12,000 people, 8,000 are dying, 4,000 are surviving. It's too bad, too poor in Nigeria. Now, according to the National Cancer Control, cancer is responsible for 72,000 deaths in Nigeria every year, with an estimated new cases of 102,000 new cases of cancer annually. Why I celebrate talking about this topic among my gender, the women. It's among this my group of people, learned, educated people. Let me just do a test. How many people have done pap smear here before? There is a test known as, thank you. Can you see this? How many hands? 2, 3, 4, 5, 6. Can you imagine what I've said? And every woman of reproductive age is at least supposed to have this thing done once every 3 years. And then you go for the examination once yearly. Next, please. Okay, cervical cancer, right, that's all. About 3.5% of women in the general population are estimated to harbor cervical, the human papilloma virus at each given time. Okay, let me explain this. Now, because we are not exposed to some of these things, even when we have some form of infections, we don't go for treatment, right? We just do our little kind of test and then we are gone. But this virus usually don't go. They still remain in that place. So you harbor them. You keep them as a career. You don't keep them as a career. You just keep them for safekeeping because they are virus and they don't just die. Do you understand? Wherever they are where it's fertile for them, they remain alive. And they are just there waiting for the right opportunity to comfort and devour. So according to the Human Papilloma Virus Center, there are predisposing factors that leads to this cancer. And because the human papilloma virus have various strains, just like the HIV-1 and the HIV-2, that's how the human papilloma virus have their strains. The one that causes this deadly disease is the stereotype of 16 and 18 and is mostly transmitted through sex. You see, men carry it and it doesn't, and they just come and give us freely because they got it somewhere and they bring it and give to their wives, or they got it mistakenly somewhere where they just go stand to ease themselves anyhow, and then they come back and give us and deposit there for us. Please, can I go forward? Okay. Causes of cervical cancer. Like I said, cervical cancer is primarily caused by persistent infection. When you keep being exposed to that human papilloma virus over and over and over. Maybe you were exposed to it when you were 16 years. You're exposed to it when you were 18, and then 19, and then 20, and then 21, and then 30, at 40, you have encounter with that human papilloma virus. You are definitely going to have risk of going down with cancer at the given time. Now, factors that increases this, gives this virus the opportunity to walk so very freely and easily into our body. When we talk about smoking, and then people say, do women smoke? Do women smoke? In fact, the rate at which women in Makurdi are smoking is becoming alarming. I have opportunity to have a shop close by, and then I see some quite young girls, and then they just hide themselves and come back, and the way they are talking to you, you feel you get the smell of everything all around you. And then I say, wow, this thing is on the increase. Ladies, young girls are smoking, and it's on the increase. And smoking is dangerous and is deadly to our immune system and our body. And when you smoke, because your immune system is already weakened, it finds it difficult to fight any infection that comes in, right? So smoking weakens our immune system. There are some immune systems that are already weakened by some medical conditions like hypertension, diseases of the kidneys, and a lot of them. So when your immune system is already weakening, you get to go down with cervical cancer. We'll talk about those that with HIV and is common with them. Can I move forward, please? Early sexual activities. Cervical cancer is a little bit common in the northern part of Nigeria and also in the rural area, where studies have shown that young girls, the age of 15, 16, that are exposed to early sexual activities go down with cervical cancer. And then we also have multiple sex partners. When I was doing this and when my husband saw this part, he was saying, do you want to talk about multiple sex partners? I said, yes, I will talk about multiple sex partners. In as much as we keep saying we are godly women, there are women that are still not faithful to their husbands. They operate more than one sexual partners. And then, if you have more than one sexual partner, you are at risk of having cancer. Another way is the polygamous lifestyle, that they have more than one or two husbands, or have more than one wife or two wives. They go there, come back to you, go on here, and like that. So you are exposed to that. And then contraceptives, some kind of contraceptives that we take, the ones the family planning stuff exposes us to cervical cancer. History. When you have, for any young woman that have history of his mother going down with cervical cancer, you just know that it runs in that family. And then you take precaution early. Will you see in my further that what you do in such histories is at the age of 9 or 11, between 9 and 14 years, you go for vaccination, and it helps you. The vaccination is for everybody if you have a child. And then the economic factors, those kind of limiting economic factors that people cannot access regular pap smear examination, and then they come in late. My colleague can testify that most of the cervical cancer cases that we have in our center here show up late. And they don't just make it all the time. Even when they proceed to the level of chemotherapy, they don't make it. And some of them don't even have money to afford chemotherapy. You know how expensive it is, right? So they just can't give it, and then they give up. And then diet and nutrition. When I was preparing this, I was thinking, I said, should I talk about diet and nutrition? Because the economy hard, isn't it? But the kind of food we eat, the kind of things, the canned food, the already made food, the shawarmas and the rest, they are not healthy for us. We don't eat good food, we eat junks, and then we feel we are eating. Even when the economy is hard, eat vegetables, eat natural food, eat fresh food. Just ensure that they are fresh, they are natural, and then they are good. The packed food, the Indomie, the already processed food predisposes us to cancer. And so when you don't have some of those good ingredients or nutrients in your body that will help you fight. How to prevent cervical cancer. I'm not being detailed because we don't have time, because if I want to talk about cervical cancer, I take a lot of time, because I want women to understand and know the value of what I say, because I'm coming from a place where I feel the pain right in my heart about cervical cancer. Now, there is human papilloma virus vaccination. In Benue State, unfortunately, the federal government introduced that some time ago. We had it. And like I was talking with the person in charge of that, not most people were convinced coming for it. It was just very few people that they were running the testing of the vaccines on them. But we had it recently in Nigeria and then in Makurdi. But it will soon come up again, because the federal government is thinking of enrolling it into the normal vaccination for female girls. So it will soon come up again. But this is going to, the cervical, the vaccination is for only between 9 years and 14 years. Do you hear me? If you have started, it is actually given to people that are not sexually active. Yeah, young ladies that don't know, that have never had intercourse or that. So that's the kind of people we give vaccination to. After then, if you give to people that are already sexually active, that harbors the virus, it won't work. Do you understand? Okay, now let's talk about the pap smear, going for pap smear every 3 years. Pap smear test helps to detect any abnormality in the cervix. When you go, what they do, they just pick a little tissue of the cervix and then take it and do some culturing and testing for cancer tissue. If there is any, I'm grateful to my mother-in-law, because immediately we saw it in her. Immediately she turned 58, we noticed it. And immediately I noticed it, we just went and took off her uterus, and she's free from cancer. So if you go for pap smear and they take some samples and then they go for the test, and you have any reaction, especially for people that have completed their family size like me. So you just remove the uterus and then you are free from it. Or we take measures to see, go further and check, is it actually this or not? If it is, we try to do away with that tissue that the human papilloma virus loves so much, and then we take away this thing. But it's going to be according to the kind of health care you go to. Some say 3 years, some say yearly, some say but the recommended, the standard one is 3 years. Within every 3 years, you should go for pap smear testing. And again, if you go this year and then they are not sure, they say come back next year. Don't go and tell them that, no, they say it's within every 3 years, so I will wait. No, depends on what your healthcare provider has said or the kind of environment. Imagine we're in the northern part of the world. I wouldn't ask us to in the north in Nigeria, I won't ask you to come back every 3 years. If I'm heading any facility, right, I'll ask them to come every year so that I check them, because you never can tell what's going to happen. Now, safe sexual practices. Practicing safe sex by using condom can reduce the risk of human papilloma virus and other sexual transmitted. Limiting the number of sexual partners can also. I said that. I talked about that, right? Part of why you prevent it. And it's no news. It's no gain to have multiple sexual partners. It's no gain at all, because there is no point. You're just exposing and risking yourself. If you are in a marriage where it's multiple, I don't know, but for me, I believe we should understand the times and seasons we are in now, so that you don't have multiple sexual partners and all that, because there is no gain. The disadvantages outweighs the advantage. For me, as a health practitioner, I have not seen any advantage. And then how do we stop this thing? I talked about smoking, and I said everybody that smokes, please stop smoking. Apart from the lung cancer that the smoking does dangerous, harmful things to, it also affects you as a woman and other parts of the body. The next slide, please. Healthy lifestyle. Do have exercise, eat vegetables, do regular exercise, do some kind of stress management. And then all these things we are trying to do is to support your immune system that will help you fight against cervical cancer. You see these people, when you are overweight, already you are compromising with your immune system. And you know, obesity falls among us, the women, right? We usually don't control our weight. And then eat healthy, exercise. Don't say, I go to the market. I trek from here to the market every day, so I'm fit. Don't say, I climb the staircase of my office, so I'm coming back, I'm fit. No. Do exercise that is recommended for you as a woman. It helps strengthen your immune system. Prudent women, for this that you are doing. Because when you don't do this, and women don't get to hear this all the time, it's in our churches, in the market, in our local gatherings. Let's not just sit down and do contribution and meeting unique sisters and unique brothers, and we just sit there. Bring people to know that there is something like this among women. When you go for your monthly meeting to do contribution or that, ask them, do you know about cervical cancer? It's good though. We can start doing something. We can go for the test, which I would discuss with us. There's a cheaper test that everybody can do. So we can go for the test, and then you can do this thing. So why not educate people? Make people aware that there is a disease. When we were in the village, in 2020, I was in the IDP camps when we were doing some tests. I keep saying, what my eyes saw, my mouth cannot see. Because I almost ran out of the camp that day. There's a particular day I almost ran out of the camp. Because I stayed there until 9 p.m. and I still had a lot of issues. to tackle. Please, if you can go to some of those places and give them health awareness, tell them that there's something like cervical cancer. Anytime you notice any infection, go to a health facility so that you'll be treated. Women, we will reduce to the barest minimum this that is affecting us. Cervical screening. In addition to pap smear, some healthcare providers may recommend that you should go for the HPV testing alongside with pap smear for more comprehensive. Yes, there are in more developed countries, they go for this screening. What they do is you lie in there, and then they view the cervix. They continually view the cervix and then view the walls where around it, and then take specimen of the fluid, the discharges that we have, and then they go over them and then they check if there is any abnormality. Once it starts turning brownish and smelling and not comfortable and then becoming more prudent and then more smelly and sticky, they begin to test you for this. But most times when we come to our local facilities, they just test us for just the routine bacterial infections and the rest that we have. So when you do that, it will be helpful. Follow medical advice. I will talk this and then talk about Kaya Mata. Maybe I will just chip in that Kaya Mata here. Unfortunately, even yesterday I had an incident. I was in the hospital yesterday night, and then my friend delivered incidents I don't want to share. But why we advised the woman not to take very hot water yesterday, somebody just walked up to her while I was there advising her, don't take hot water because you're still bleeding. And then somebody it's a lie. It's hot water that will clear the blood in the stomach. And then I just asked her, Madam, your own, which professor you be? Take advice from medical personnel. Stop this issue of going to do douching, going to buy fem-tight soaps, buy the Kaya Mata. We were in the units on, when was it, ma? On Tuesday or Wednesday. Somebody came with Kaya Mata into our office confidently and handed Kaya Mata to us that we should buy. And then we now say, what is this? It's Kaya Mata now. You chew it, you eat it, you soak it. See, many women have lost not just having cervical cancer, they have lost their vaginal openings because of Kaya Mata. We have seen plenty. We have not seen small. And there are many of you here that go ahead and just keep buying those things. And then you use your hand and cause trouble. There was one that we were nursing, trying to at least give her a hoe again so that she will feel like a woman. And then she sat down and just told me, she's a learned woman. She's a lecturer in a prestigious university. And then she was just telling her, she used her hands. She just told me that, I used my hands to buy this trouble. I said, yes, you did. Because you don't take medical advice. And then we say, don't douche with some of these things. Somebody came and told me about Kenaperi. What is Kenaperi called in English now? I forgot. Cloves. It says soak cloves for 3 days and then start washing your private part with it. It will make sense. And then I just look at her. I say, why are you telling this? Is it me? She said, yes. I said, thank you. My private part is as tight as anything. I don't want it to be tighter than this because this same private part that you don't know, even if it is 2 cm, by the time you want to have sex, it can dilate up to 4 cm. If you like, do it to be tight as anything. Once it is wet, it's an elastic part of the body. That's why your baby with head of 10 cm can pass through that. That's how God has made it. So when you want us to come and make it too tight by force and becomes 2 cm, you are creating your own. We are okay medically with what God has done. So please desist. And this Kaya Mata that you people insert, do you think about it? Do you think some people do it and then they say, immediately I put it, I run to the bedroom to wash. Hey, the way that thing will be peppering me. And we keep hearing this thing every day. I don't know anything that will be peppering me and I will continue to use it. Me, I will not do it. Maintain a healthy immune system. I've talked about that. Adequate rest, stress management. I want to talk about adequate rest for women. Women don't rest, including me. I don't rest. I had a turbulent day yesterday from 7:30 yesterday till this morning. I've not had sleep of 3 hours at a stretch. I don't rest. But it weakens our immune system, right? So what you do, women don't rest. My baby is crying. We're running here and that. So please, let's find time to rest. It helps build our immune system. Detecting cervical cancer early. Detecting cervical cancer early is crucial for effective treatment. I just told you people here that if you detect cervical cancer early, it will help us. And I say, many times people come already what? Gone past time to help. We no longer can help them. What we just do is to just help them to extend their lifestyle. The men that are discussing and distracting, better learn this thing because you will soon have wife. When you have wife, you will know. Now, like what I said, that's how to detect it. One of the best methods is a pap smear. Please, my fellow women, if you are here and you have never done, and then my brothers, if you are here, if your sister have not heard it, if your mother have not done it, please help them to do it. There is a section, every hospital in Makurdi, talk of teaching hospital, talk of FMC, and other hospital does pap smear. And then I was supposed to get the monthly one that is going to come up by the Medical Women Association of Nigerian Doctors, but I didn't get that. She wasn't sure of when it's going to come around this time around. But if I get the date, I'll drop it in the Prudent Women group. As many that are there will see it, and then maybe we'll spray or you could reach out to the president. She will let me know, and then we will fix the day. It involves collecting cells from the cervix to check for abnormalities. Women should start getting pap smear at the age of 21. Follow their health care providers, like I said earlier, this thing. And then testing for the human papilloma virus is a common cause of cervical cancer. And then testing can identify high risk strains. When you go to a clinic, I don't think this is commonly done here in Nigeria because I've not done it. Even during my training for cervical cancer, I've not done it. We've not done this particular test. But I know in the USA, like they do, they pack some, just test them, pack some fluids in the vagina and then take for test. If there is any strains, they test for human papilloma 1, papilloma 2, papilloma 3, and then if the one that is 16 and 18 is found, then they know this person is at risk, and then they do this thing. Then the visual inspection. This is the one that we do more often. And I was thinking I was going to make arrangement for this within us. If you are interested, you just come, we lie you down, we view the organ, we use our eyes, we use an organ, the speculum, we view it. If there is any abnormality, we pick fluid from there, and then we drop the acetic acid on it. If it reacts positive, we now refer you to go and do the pap smear to confirm that. So this can be done. If you do this, this is not expensive. If you arrange somebody, if we are up to 20, 40, I can't remember now, but when we go to the IDP camps, somebody sponsored and we could even do for them 300. But if we are up to 20, 40, I think we can do for here for 1,000. And like that. I'm not sure now because I can't give the definite word. But this can be arranged. You just do the visualization. We monitor the part. And then if we sense anything positive, we send you for pap smear, where you go get pap smear. Then the guideline for it, your health care is there, and then you follow the guideline of your country, and then these guidelines specify when and how often you should go for cervical cancer screening based on your age and then the risk factors. You know the risk factors I talked about, right? It runs in your family, you are having multiple sexual partners, if you know that you have to be going for screening early, frequent, isn't it? And then if you are in a reproductive age, like my own age, from that 21 down upward, you know that between 30 and 40, we are at our peak and prime, right? So you know that you shouldn't miss that. You shouldn't miss going for screening because you are in the very high reproductive age and you are exposed to sexual activities more, isn't it? So you could go for that often. Self-examination. I wouldn't advise so many people to do it because in this our part of the country, we don't understand some of those things. But like me that have gone through training, I can do self-examination and then I can understand. Self-examination could also that there is an abnormal smell. If you notice, if you dip your hands, you're getting, instead of getting that white discharge, you're getting brownish discharge, and then you are having infection often. You examine yourself, isn't it? This thing is not like this before. It's like this before. Or when you are not supposed to see your menstrual period, and then blood just keeps coming up, poo, 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 you know that, wow, no, I have to come and see the health professional. But you just need to, the one that you do for yourself. I don't think most of us can do it, but if you can, fine. Know the symptoms. Be aware of potential symptoms of cervical cancer, such as abnormal vaginal bleeding. Did I mention that? When you start seeing your period 2 times every month, don't sit with it at once. Say, me, I'm that kind of person that see my period 2 times. It's not correct. That's not what God has done. Look for help. Do you hear me? Abnormal bleeding, bleeding in between periods. After sex, when you have sex, you bleed. For women that have clocked 50 and above that have menopause, when after menopause, you're not supposed to bleed. Your organs should have shrink. But any woman that have cancer or is having threats of cancer bleeds once in a while. So once you see those kind of abnormal discharges or blood, please rush to the hospital. Please, my gender, rush to the hospital. Don't treat at home. Don't cook Oziza leaf and the rest and sit in it. That it kills it. Please, it doesn't. It doesn't. When you start having pelvic pain and then unusual vaginal discharge, like I said, meet your health professional. Come, we will talk to you. Please, health is not expensive the way you think. The way you think that it is. There are other ways around these things. There are ways around these things. You can get help. Vaccination. I've talked about vaccination. Please, it is recommended for adolescents and young people. Please, if you have a daughter and maybe probably there are some of us here that are already going through some treatment, cervical treatment and like that, or that they have noticed. Please, if you have your daughter, do her justice by looking and seeking for where there is vaccination and give her. I don't know how much it is. I was trying to find out from somebody that did. She said she did in Abuja at 18,000, but I'm not sure of how it is in private institutions there because I'm not used to. I want to say encourage my women, encourage my gender. We are special, we are unique. If you know what our body is made of, if you know how God has designed us, wonderful organs, wonderful creatures, and then everything, I just told somebody that the devil just wants to steal all the good things that God has for us, and then we are allowing the devil to do it by not being careful and taking note of ourselves or not caring for ourselves. So I pray that after I finish this year, when we conduct every assessment, we will have less cases in Jesus' name. God will not heal all of us, so some of us need to go to the hospital. Do you hear us?